Suicide in the Indigenous population. Suicide and self-inflicted injuries are the leading cause of death for Canada's Indigenous population. This is a very disturbing reality that we need to be aware of as social workers. A major factor in the high suicide rates is the trauma that Indigenous people have endured and continue to endure. This trauma began with the colonization in the 1800s. The earliest impact European colonization had on Indigenous peoples in North America was the introduction of infectious diseases such as smallpox and measles. An estimated 90 to 95% of the Indigenous population was decimated. A mass genocide of so many innocent people is inconceivable and heartbreaking. Another detrimental factor to the Indigenous population is the residential schools that existed for over 100 years. The repercussions are a loss of culture, language, traditional values, family bonding, life and parenting skills, self-respect, and the respect for others. Their parents, in turn, lost their roles as caregivers, nurturers, teachers, and family decision makers. Upon release from the schools, survivors reported a legacy of alcohol and drug abuse problems, feelings of hopelessness, dependency, isolation, low self-esteem, suicide behaviors, prostitution, gambling, homelessness, sexual abuse, and violence. These traumatic consequences continue to plague the Indigenous population. It is believed that intergenerational trauma lasts 7 generations.
Before coming to the social work program, we knew that the Indigenous population as a whole is suffering, but we didn't realize the full extent of the causes of this suffering. The Indigenous people have faced so many injustices since the arrival of the European ancestors. This was hard for us to hear, that it was our people that caused these hardships. The Indigenous population feels that they are at a loss and that nobody is willing to acknowledge the hardships that they are enduring, and in return feel that suicide is the best option to deal with the pain. We, as emerging social workers, need to be very sensitive and aware of these feelings when working with this population. Research has proven that the Indigenous population doesn't have the same access to healthcare as non-Indigenous. Suggested causes include socioeconomic equality, such as lower education and employment, geographic isolation from healthcare facilities, as well as socio-cultural variation, particularly in the terms of attitudes towards seeking healthcare. Displacement from ancestral lands to reserves, frequently located in remote in-hospital regions, may represent an important additional factor. In this case, we feel the Indigenous people are dealing with discrimination and equality when it comes to their healthcare needs.
The statistics that we would collected show the alarming difference between suicides in the Indigenous population compared to non-Indigenous. The rates are higher than in other groups. In Canadian Aboriginal youth have the highest rate of suicide than any other identified culture in the world. Among Aboriginal males aged 15 to 24, the suicide rate was 126 per 100,000 compared to 24 per 100,000 for non-Aboriginal males of the same age group. First Nations women aged 15 to 24 had a rate of completed suicides of 35 per 100,000 compared to 4 per 100,000 for non-Aboriginal women. First Nations males are at a greater risk for completed suicide, but at a lower risk than females for attempted suicide. Females aged 15 to 24 and males aged 14 to 25 are the most targeted groups to commit suicide in the Indigenous population. Society is finding a trend that when one family member commits suicide, then it is more common for multiple family members to commit suicide as well. This is referred to as the ripple effect. This demonstrates that suicide affects more than just the person who completes it. The traumatic experience leaves scars on the victim's loved ones as well.
The people most affected by suicide in Canada are the Inuit population. The Inuit of Arctic Canada have a suicide rate that is among the highest in the world and 10 times that for the rest of Canada. Some concerning statistics that we have realized are in 2009, the suicide rate among the Inuit in Nunavut was 83.9 per 100,000. In 2008, the rest of Canada's suicide rate was 11.7 per 100,000. Some of the major factors are romantic relationship problems, family problems, changes in kinship patterns and relationships, and most notably, intergenerational segregation. Some reserves are facing multiple suicides or attempted suicides in short periods of time. Attawapiskat in Ontario faced a state of emergency in 2016. Out of the 2,000 members, 100 of them tried to end their lives in 7 months. In La Ronge and surrounding areas in Saskatchewan, 6 young Indigenous girls committed suicide in October. They were between the ages of 10 to 14.
Suicide affects all of us in some way. It is likely that we will be faced with the loss of a friend, family member, or client from suicide. It is a difficult topic to understand, and there is negative stigma attached, which makes people afraid to talk about it. When someone suicides, it causes anger, guilt, and pain to the survivors and leaves us asking, why? Through learning about the reasons that people commit or attempt suicide, we can begin to empathize with their situation. People need to know they are not alone and there is help, despite this being a controversial topic.